Hola, hola, how are you doing? How's your Sunday going? Hi. Still just doing the braids. Actually, I was going to do my braids over the weekend. Yeah, I started it last night, so I am doing the remainder. I was going to do a live last night, but I figured Marcy was going to slow me down a little bit. And the back part is always the hardest, so no. So thank you for tuning in. I don't know who is on. Bikes Girl, Coffee. How are you doing? How is your Sunday going? I haven't been here like this in a long time. So how is your weekend going? You can say hi. How was your weekend? Just doing them like this. So what I'm doing is putting in this just to kind of have a little bit of a stretch because my hair is just gonna be too kinky. After I want to keep it for probably like a few weeks or months. So I'll just put that in and then I'll do the strand at the root. And once I get back, and I will just stick out into. Probably should play some music. Oh, you can go ahead and double tap the screen, double tap the screen, like up the live, you can also share it. Alright. Richmond, hola. Maria, welcome. TikToker, welcome. How are you guys doing? Alright. And this is it. So, this light is making me feel hot. Oh, let me get some music playing. Self-love, hola, Kiki Slims. How are you guys doing? Alright, let's play some music. Alrighty. I do use, this is the Dubro. This is the Dubro product line. I do use the, I think it's another air fertilizer as well. Is it? Stimulating ear oil. So this is what I use as well. And then in this, I have water, tea tree oil, ginseng, coconut oil, castor oil, mix up. So I do put the sulfur in it, and it has a nice fresher feeling after. Yeah, like when I'm, like, you know, when I just wash my hair for the first few days, I'll definitely use Blue Grow. And sometimes if I don't use this one, I'll use this one on the scalp to keep it oily. And yeah, that's about it. Well, there's a lot of things in there. So like now, I have this in my hair. And this. Because I wash my hair, so I kind of put this in it to soften it up. And then I'll part through my hair and put this in it. Because I like when it's soft and, yeah, I don't like when it's too dry. So I kind of wet it back up after, you know, it's dried for a few hours. And I try not to use any blow dryer in it. I did use blow dryer probably twice in the last probably 4 years. Yeah, I did cut it off and say I wasn't going to be using any more blow dryer because I wanted it to be like virgin hair. So try not to get it damaged. I don't think it was damaged at the time. I think probably because COVID, you know, was a thing. And I wanted to kind of give my hair a bit of a break. I guess probably because I was covering it up so much with the bouffant cap. I decided to just go ahead and chop it a little bit. But I never chop it correctly, but I have no regrets with the chop. How long? So this I started yesterday evening. So usually I finish this in probably like four hours. So yesterday I started this around after 7, around 8 o'clock, yeah. Because I think it was like about 7:40 when I started it. But at the same time, when I started it yesterday, I had, I don't know if you had seen my hair last week. So I had some of these in it, so I had to pull it down and then rinse it and all of those things. Yes. But usually it takes about 4 to 6 hours. And give or take, you know, sometimes I might get up and be doing other things. Like when I do the other braid that you see on my profile, that will take probably a couple days as well. I'm supposed to just sit down and do it. It probably take me 3 days to do it. But when I'm doing my natural hair like this, it's probably like 4 to 6 hours with me getting up. I just decided this is all I'm going to be doing for today. I'm going to say probably 4 hours. Without the fingernail. Because this fingernail, they're a little bit longer than my usual, so it's kind of preventing me from going a little faster. But it's worth it, I guess. Yeah, it's worth it because when I'm done, I don't need to be doing anything much more than just oiling it for work. So that's just it. Alright, so I'm going to do this side a little bit longer because I want most of the fall to be on this side. Because when I'm going to be catching it up, I'll probably do something like this, you know, with a little rubber band. So that way it still has enough ends over this side. Yeah, so then now I'm going to go over this side. Alright. scrunchie. And this is what I use to comb it. Because it's like tough. It's a lot of hair. Yeah. So I'm gonna do this one. So this one I'm gonna do in 3. When it comes down to the side ones, you know, like they're my babies. I protect them because I don't want to lose my edges. I don't want to lose my edges. So I'll put, for that one, I'm going to put this amount of braids there. This amount. It's not much, but it will just make it stay in place for the entire time. And as I say, I'll do this. And then kind of just knot it a little at the root. Yeah. And then once I do that, I put it back on the other side. And as I say, I'm not a hairdresser, so please bear with me. And then this is my natural hair. I just separate it in 2. Then I'll do a 3-strand plait. And then I'll just bring it back into 2. And then I'll just twist it out. But just try to make sure you're twisting real tight right here, where you're separating the 3 into 2, so it doesn't have too much of a bulgy look at the end. Alright. And then that's it. But it's not bad. Once you can twist out your own hair, your braids, then you should be fine. The hardest part is the back part. Yeah. The hardest part is the back part. Thank you for the likes, Tony. Thank you, and thank you for joining. Alright, this is it. So this part, yeah, this is what I realized the other day. I think probably because I retwisted the front of my braids, so the 4 locks I had in, I retwisted it probably like 3 times, the front, which I don't normally do. And I think probably it was a little bit too tight, because at one point it was like, oh my word, I could feel it in my forehead, and I could feel it on my scalp. So I know I was going to lose a little bit of a hair over this side. So that's why I say I'm kind of giving it a break from that one, because there's a lot of tension when you're putting the 4 locks on the scalp. So I'm going to try work on getting this section, you know, a little bit thicker. It's going to be hard, but and then when I'm pulling down, it's going to be so much easier to pull it down, because I am familiar with how I twist it. The shrinkage. What about the oh, yeah. So if it was my natural hair, it would be a little bit more, you know, shrinker than this. But because I'm putting in this with it as well, it kind of, it's a little bit, you know, it's a little bit of a length on it. And yeah. So I put this in it to kind of hold it, because I don't want it to have this kinky look. And then after a while, when it's my natural hair, probably like in probably like 1 month, I start hating it because it's too shrink up. So I put this with it to kind of stretch it a little bit more. Melissa. Hola to you too. Yeah. So that's what I do. And then I'm gonna leave that one. So like this little one here, or just do it. So this little one, this is the problem one. So this one, I'm gonna do it a little thicker with the amount of hair. I'll probably do this. Because it's not the same length as the others. And then what I'll do with these, this one, see that it's so short, so I want to preserve it. I don't want it to break anymore. I'm just going to do the 3-strand plait for all of that one. And as I say, I don't do it too tight because I don't want it to pull too much on my scalp. I'll do that. And then I'll separate it. And I'll just do the 3-strand plait for this one all the way out. Because it might just start loosening out. And then I'll just do the 2-strand. Hi Charles, how are you doing? Thank you everyone for tuning in. If you don't mind tapping up your live a little bit, that'd be nice. And if you're a nurse, you can follow me. I'm a nurse, ER nurse to be exact. I do house call as a nurse practitioner. And I have a YT page. You can go ahead and follow me there. The full length of my videos are usually on YT at ThinkNursing. And you can follow me here on TikTok as well. I share real life stories. I'm a transitional nurse as well, so I'll talk about that. So if you have any questions, feel free to go ahead and ask me. I'm pretty transparent with a lot of things, so feel free to, inbox me if you don't want everybody else to know your business. You know them way there. Yeah, and on Thursdays we're doing NCLEX practice questions. Not only for persons in NCLEX, but if you're in the Caribbean, you're going to be doing the RE/NR exam. It will benefit you as well. So definitely go ahead and tune in on Wednesdays at 8. I'm going to try to do probably like 2 days, but I can commit to Thursdays for now until my schedule is a little bit better. Then I'll probably do on Tuesdays. Oh, as an international nurse, transitioning from one location to the other. So I transitioned from Jamaica to the States here with a recruiting company. So I talk a lot about that because there are persons who are wanting to, migrate and they don't know, or they're looking for opportunity and they don't know how to get, started with the process, especially with a recruiting company, or if you're planning on doing like direct hire as well, then definitely I can help you, answer some of your questions. So I do live on, I'm gonna say at 7 o'clock, most of the time between 7 and 8 o'clock. So you can always check me out at that time. And we can have a chit chat. They're usually pretty interactive, so feel free to come over and say hi and follow. And if you know anybody, and I talk about my nursing journey as well, growing up in Jamaica, I do share that because that's what my YT page is for. Sharing stories to motivate versus encourage them, educate them, things like that. So I'm hoping to do a podcast later on in life. We're talking a lot with nurses, sharing their background, their story, their experience in their home country or, here in the States, wherever. Just hear a little bit more about them, highlight them a little bit more. And I'm planning, I want to do a foundation as well. I want to give back, and that is something that I'm looking forward to, I'm working towards. So, you can hit me up. I'm hoping to do a lot of volunteer service, going back to different places. I want to start with my country first, because I always want to give back to my country. So I want to do that. So if you're in the, for example, you want to probably take a trip to Jamaica, we can always do that as a group from the platform and just give back. You understand, and enjoy the time you're there. So those are things that I definitely want to do. Yes, it is. Definitely, definitely. You understand? So all of those are things that I have planned for my platform. So definitely go ahead and subscribe and subscribe to my YT page at Think Nursing. It's one word. Think Nursing, one word. And follow me here on TikTok as well at Think Nursing One. All right. I'm originally from Manchester, Tyrian. I'm originally from Manchester. That's where I did my nursing. You know, at Northern Caribbean University. Went to Manchester High School and worked at the Manchester Regional Hospital. Get my experience. You know, have no regrets with anything that I did back there. And then here I am in the States. Yeah. So I got opportunity, so I took it. And I have no regrets. You know, I have no regrets. Thank you. Thank you. Where are you from, Tyrian? So I want to help, other persons out there, students. I just want to be a change agent, let's just say. Not only for my patients, but in my community, things like that. Yeah. So definitely go ahead and follow me. Alright. I post a little bit of everything. If I go on a farm and, we see cows and all them things there, definitely I'll post things that will entertain you. Keep you active on my page. Not all the time you want to hear nursing things. You don't want to hear a nursing story all the time. So I do post things like, if I go back to my community, I probably just show you one or two things. Yeah, so that's about it. Still trying to make sure the page is, professional. It's an environment that everybody can come and watch one or two things. Definitely, Charles. I am originally from Spanish to teach at college in St. Anne. Okay. I have a sister who is a teacher in Jamaica. Yeah, my eldest sister is a teacher. So yeah. So that's about me in a nutshell. Alright. And as I say, if you want to hear a lot of stories regarding my background, I do talk about my background. So okay, nice. I do talk a lot about my background growing up. So definitely go over there and shed some tears with me. And what else? And then you can always ask me any question. You understand? Over there and ball too. KC Events, welcome from Westmoreland. I'm in my second semester of nursing school. Okay, nice. Congratulations and welcome to the profession. What university are you going to? One King, welcome. Yeah, man, I talk a lot about my journey, growing up. And I'm going to talk about it today because I want to ball again on TikTok. I don't want to cry on TikTok. You have the onion sometimes just decide to do a little bit of a trick while you're talking about some stories. Yes, so it's very emotional for me a lot of times, so I don't really like talk about it. But I did share it. I did share it here on TikTok multiple times, and I did share it on YT in my videos, and sometimes on my live as well. I'm talking about it because persons always asking. But that's about it. Marcia, you're from Manchester too? Okay, Marcia Lindo. Okay. There's a young lady in my class by the name of Melissa Lindo. Who else? In Chester. Yeah, that's where I'm from. What side of Manchester are you from? We all have that past energy. Yeah, definitely. So I do share it. And as I say, I created my page just to enlighten, show people that, you don't have to let your environment dictate where you go in life. And that was the whole thought behind creating that page. As well as when it comes down to transitioning, I wanted persons to have resources, especially from the Caribbean or from Jamaica. Because when I was transitioning, I never really see much of that content. So I wanted it to be a very transparent page where, I share the ins and outs of transitioning, working here in the States, and whether or not we love it or not, you understand? So basically that's it. But it's not something that is gonna push away persons from the field of nursing. But at least if you're thinking about wanting to come into nursing, at least my experience I can share with you, and then from there, as well as I'm trying to get other persons to come onto the platform to share either a day in the life of a nurse, where you can hear what it is like being a CRNA, ICU nurse, emergency room nurse. So just in case that is something that you want to do, you have a passion for that area, at least you hear it from somebody else's mouth. You understand, rather than just be reading it in a textbook or just hearing people just randomly say one and two things. But at least you'll hear, typical day in the life of a nurse, or it might be a person that, has, who has, achieved, gone above and beyond. You understand? And probably persons never really expected them. If you're that kind of person, you think you have a story, then those are the stories I want to showcase on the platform. You understand? If you're a truck driver, you want to talk about your journey, we don't have a problem, talking with you. But I'm just letting you know, I want it to be a page that is very positive, and that's just it. Positive one, do you know the Gales from Manchester? Well, my principal at one point was Mr. Gale. At Manchester High School. It says from Porus. Okay. I'm from Seoul, so I don't know if you know North Patrick, Asia, that side. Yeah, that's the section I'm from. But I know a few Gale, then I don't know, she wasn't in my batch. She was in a few batch behind me. That her last name was Gale, but yeah. Thanks for the follow, Melissa. Yeah, so that's just it. Are you, I have landed one. You have landed on Mount Elephant? Oh yeah, tell Mr. Charles. Yes, where shall we come from? I was looking at your face and I see your face kind of look familiar, but then I wasn't really so sure. But I know Mount Oliphant, yeah. Not in so much detail, but you know the Williams from Mount Oliphant. Pike All Age. I don't know Pike All Age though. Okay, yeah man, that's where I'm from. So that's home. You understand? So when I hear they say, where are you from? And I say Manchester, down that bush side I'm talking about. That's countryside. Alright. Yeah, that's where home is for me. So which side you come from, Charles? So you say you have landed on Mount Oliphant. Which side you originally come from? Because the Mount Oliphant, they're doing a lot of development over there. So I don't know if it's a case where you probably purchased a land over there recently or you're originally from that side. Oh, see? So, okay. Yeah, so that's it. Yeah, that's the section I'm from. So you like it down there, how the red dirt treating you down that side? You wear your white sneakers down there? 15 years ago? Okay, so you've been down there a lot of time. Okay. I was probably there 15 years ago. I was still in Manchester. I was at Mandeville Hospital. That's all. Not so long, but I was at King College. Okay, that's not bad. Oh, you get used to it? Me too. I remember the days when I used to walk in Sweetland and walking with our shoes. You can't wear your regular shoes in Sweetland because Sweetland road was so, the road, it wasn't paved or anything. It was just like red dirt. I almost have the dirt red. It was like so red. And we used to walk with extra shoes out to the main road before we could actually, so we don't have to get our shoes all messy or, your foot. If you're wearing a slippers, yeah man, you could never be walking in Sweetland town. You have to be putting on like an actual cover up in terms of shoes. Because by the time you reach out there, everybody in the town, when you go into Mandeville town, everybody know that you're coming from Sweetland or you're coming from South Manchester. Especially when it rains as well. If it rains and you decided to probably wear your shoes, and you never bring a second one, let's just say, or the rain did catch you on your way out, yeah man, everybody know that you're coming from Sweetland because your shoes is like so muddy, and even if you wipe it off, you know you still have the imprints in the bottom of the shoes, and so everybody would know that you're coming from Sweetland or you're coming from South Manchester. And taxis never really want to come in Sweetland. They never really wanted to come in Sweetland because they always complain about them car. They always complain about.
Hi Panther Walk, how are you?
There's a replay. Hard to go in, you know, if it is raining or if you go to the supermarket because it's always dusty. It's always dusty. My dad was from Hartfield. I think you're saying probably Hearties in Manchester. Oh, Heatsfield. Okay. But I'm close to Heatsfield. Yeah, but them time then Lord, nobody really want to go into Sweetland. You understand? Nobody. Once you see the road, them stop. Them just stop. You understand? Because that was just it. But it was okay, I would say. It was okay. Looking back now, the road is still not better, you know. It's still not better, but it's better than what it was. And then because they have a lot of persons, because the quality of the soil in Sweetland or down South Manchester itself is so good, you have a lot of mining. So you have bauxite companies mining out the land down there, and so it just make it worse in some areas. But, you know, I remember my days, yeah. When it rains, you definitely really don't want to be in Sweetland. You don't want to be walking in Sweetland because it's not a good look. But nowadays, it's a little bit better. Yeah. Big Will, welcome. I'm a mom. Yeah, so a lot of people never used to wear, they will wear their sneakers, but majority of the time, they will, this one never really do well. They will carry their extra shoes out to the main road, and we usually hide it out by, there was a gentleman down there by the name of, he's still there, Mass Lambert, the Ledfords. We used to hide our shoes over by Mr. Ledford's house. Mr. Ledford never normally have any problem with that, you understand? Because him understand. So every day you go out there, you see a ton of shoes over by Mr. Ledford, you know, land. Because everybody hiding their shoes over there. So they're coming back in the evening, they can get their shoes. And it was the same thing I went to church. Same thing, I don't want to wear the church shoes as a child, you know, in Sweetland because the stocking gonna get messy, everything is gonna get messy with dirt. But yeah, how often do you come home? I try to come down like, you know, sometimes 2 times, 3 times. Last time I was home was in February. I haven't been back home since. Probably go back down December. Depends, yeah. But yeah, I like to go home because I still feel like, you know, a part of the community. You know, yeah. So I like that. I get a chance to walk and just enjoy country life a little bit. Because American life boring, you know. I guess not because I don't really party. I don't party or anything like that. So it's boring for me. You understand? It's more work, home, and that's it. I probably go out for dinner and just hang out with friends. But apart from that, yeah. So when I go home, I get a chance to walk and go look Nesberry, climb tree. You know them way there? Pick tangerine, go look pan chicken, walk in a bush. Yeah, man. So I miss all of that. Up here, the sun just hot and warm going up every day. You know, and work. Yeah, no. When I go back to Jamaica, I have a peace of mind. I just enjoy country life. And go look for my neighbors then. You know them way there? Yeah, man. So, I like when I go home. Do you think you and the others could come together and make the road better? You know, let me tell you what happened. You know that road, it's sad to say, you know, but we had, what do you call it, the MP? Yeah, man. They even name this highway from his name. So he has a high school down there. He has a road down there. He also has a major highway in the parish. What else? A bunch of things. And for some strange reason, the road that he live on never fixed. You understand? And so you have some persons down there who, like whenever it is, politics time, we always go ahead and try to make things look good. So they carry a bunch of marl and just put it on the road and just leave it. So everybody just dusty after a while. You understand, with marl. But then as soon as the rain falls, it washes away. But never have they thought about, actually doing a road repair. The man passed. Look here, the man come mix me up, Charles. Yes, they've never thought about, fixing the road. Never. And it's just so sad because it's just down in that community, the two communities, his road and my community. The road not fixed, you understand? And it was just so sad. But anyways, you have some persons in the community who has, like there's this gentleman who has a lot of money, you understand? And he decided to fix, up to where he live. You understand? So we can drive the car up to where he live. And that was it. So the road is a little bit better in some parts.